Hi, I'm Dr. Ram here. So I'm going to explain you very important topic in genetic and also very confusing topic too. And this is Prader-Willi syndrome and Angelman syndrome. And how we are going to see in this video is first I'm going to explain using whiteboard, and then I'm going to read some important information from my MedMadness textbook, and then I'm going to ask you some questions at the end of this video and you will answer. Fine. And while you finish this, you will be very clear of Angelman syndrome or Prader-Willi or genomic imprinting, any other terms. Okay, I will be very clear in all this. Right. First, let's move on to the whiteboard and to explain this Prader-Willi and Angelman syndrome. Right. And here is the offspring that is receiving chromosomes from the father as well as the genes that is coming from the father. 50% of genes that is coming from the father, 50% comes from the mother. Am I right? So I'm taking only the 15th chromosome. Here there are a lot of genes are present, right? So this is the offspring, the 15th chromosome that is coming from the father, 15th chromosome coming from the mother. Okay, what is imprinting? Imprinting means switching off the function. For example, uh, I'm pointing out, for example, this region, 15th chromosome, this region, some genes may be switched off or say silenced or say imprinted. So this is a normal physiological concept. Imprinting is a normal thing that is happening in the egg or a sperm. Some genes are silenced or say switched off Some genes are switched off. For example, 15 chromosome, the some of the genes from the father may be switched off or say imprinted. Some of the genes from the mother may be imprinted. This is a normal phenomenon. But there can be disorders, genetical disorders in this imprinting. We have to understand that. Okay. For example, this is 15th chromosome that comes from the father, the 15th chromosome that comes from the mother. What happens? There is a deletion of some genes in the paternal chromosomes. Then you can be asking, a gene on the 15th chromosome of the mother, maternal derived chromosomes, can be working. Yes, it can work, but in some cases that goes for imprinting, switching off or say silence or say non-functioning genes on the maternal chromosomes. So if this happens, this is called Prader-Willi syndrome. Okay, so the Prader-Willi syndrome, I will show you some picture to memorize the clinical feature, that clinical features that will be very very useful for you. Fine. So again I'm repeating. So the Prader-Willi, P for feet, paternal derived genes on the chromosome 15 is lost, and then the maternally derived genes on the 15th chromosome must be working, but it is imprinted on some cases to result in the disease called Prader-Willi. And there is another concept that result in Prader-Willi syndrome, that is called UPD, uniparental disomy. Here I put the green from the mother, right? So both the chromosomes, both the genes that is coming from the mother, there is no paternally derived genes. Then you can be asking me, then the 15 some portions on the genes on the 15th chromosome must be functioning, right? Sometimes it goes for imprinting or say switching off, that results in Prader-Willi syndrome. So remember, loss of some segments of DNA on the 15th chromosome of paternally derived genes is called Prader-Willi syndrome. Okay, well, what is happening in the Angelman syndrome? Okay, the opposite is happening. The maternally derived genes are deleted. And what happens in the father? My paternally derived genes are imprinted. Okay, this is normal, and this is pathology. Deletion is pathology, imprinting is normal physiology. Fine. And sometimes uniparental disomy, that is paternally derived, paternal UPD can happen, and that paternal UPD imprinting happens on the gene. In Angelman we have found out the gene name UBE3A. Later I will show you in my PDF. So that's resulting in the brain development actually, but in Angelman, like happy face, I'll show you. Okay, I will show you some picture to memorize, and then I'm going to ask you some questions. Now I hope you have understood this. Now let's go through some important differentiating table, and then I'm going to ask you some questions. I'm going to show you some picture to memorize all this. Okay, so genomic imprinting means some genes are selectively silenced. Some genes are selectively silenced. Fine. So there is some disorders of imprinting disorders like Angelman or a Prader-Willi syndrome. Fine. So there's Prader-Willi syndrome, loss of expression of paternally derived genes in the 15q. Fine. And that can result from either UPD, maternal UPD, or paternal deletion. Paternal deletion or maternal UPD. Fine. There are some clinical features I have shown you in my picture. And then Angelman, loss of maternally derived genes in the 15q area. That can result from maternal deletion or UPD. Okay, UPD, paternal UPD. Or I told you like UBE3A mutation. That is the gene that is responsible for the brain development. Fine. I will make you memorize all these clinical features in a while. Fine. So this is the comparing features. So this is and this point I'll make you memorize now. Fine. So this is a picture I want to show you. Think of Prader-Willi syndrome baby to be like this. Okay, obese baby. See the eyes, almond shaped eyes, obese baby, and the muscles are all very weak, hypotonia. And remember hyperphagia also, hyperphagia, hypotonia, and obesity. That is very important point, right? And for Angelman, remember, like very happy angel, happy, very happy, flapping hands, very happy, and on a wheelchair because of ataxia. These are some important clinical features. Very happy, inappropriate laughter, flapping hands, small head, I mean microcephaly, ataxia because of wheelchair. Remember this two picture you memorize with two pictures, because you don't use mnemonic for all the cases in the USMLE, because that will be like disaster in the end. So remember as pictures, the overview pictures is very important. Fine. Now I'm going to ask you some questions. A 2-year-old boy is brought to the pediatrician, poor feeding, weak muscle tone, developmental delay. His parents mentioned that he was a floppy baby at birth. Okay, and increased appetite, hyperphagia. Fine. And almond shaped eyes, narrow forehead and small hands and feet, short stature, almond shaped eyes, narrow forehead. So this is Prader-Willi syndrome that can be due to paternal deletion of the 15q deletion or maternal UPD of chromosome 15. Fine. And Angelman syndrome example, for example, development delay, seizures, frequent episodes, inappropriate laughter on 4-year-old girl, and microcephaly, ataxic gait, and hand flapping movements. What is genetic abnormality in this patient? Angelman syndrome due to maternal deletion or paternal uniparental disomy of chromosome 15. Fine? Easy, right? Okay. So now just 2 more minutes. I'm going to revise it using quiz, and just check yourself with this quiz. What is genomic imprinting? Random silencing of all genes? No. Selective gene expression based on maternal or paternal origin. That is the answer. And which genetic mechanism most responds for PWS? Paternal deletion. Okay. And hyperphagia, obesity, almond shaped eyes, hypogonadism is PWS. Angelman syndrome hallmark feature is ataxia and seizures. All other are PWS. Remember the wheelchair for Angelman syndrome. Which diagnostic test is a gold standard? Karyotyping, DNA sequencing, DNA methylation. Yeah, I forgot to told you about DNA methylation, right? So DNA methylation, if a methylation of any segment of a DNA is happening, then that portion of a gene is switched off. That portion of DNA, I mean the gene is switched off with the help of this methylation. Just remember that for USMLE Step 1, that is enough. fine. And so DNA methylation analysis, that is the answer. And 4-year-old girl, frequent laughter, seizures, attacks, and microcephaly, most likely maternal deletion, yes, or paternal UPD. Yeah, both can be the answer. So paternal UPD or maternal deletion. Yeah. So what distinguishes Angelman syndrome from Prader-Willi syndrome? So Angelman affects the maternal genes, PWS affects the paternal genes. Yeah, that's great. Angelman causes obesity, PWS, seizures. Angelman, no, they are reversed, right? Both syndromes have identical genetic causes, no. Prader-Willi syndrome affects gait coordination, no. Gait for Angelman and PWS for hypotonia. So answer is A. Uniparental disomy refers to loss of an entire chromosome, gain of an extra chromosome from one parent, inheritance of both chromosome copies from a single parent. Answer is C. What feature is most associated with Prader-Willi syndrome in infancy? So PWS, so severe hypotonia and poor feeding. Most associated with PWS in infancy, hyperphagia, obesity, seizures, ataxias, Angelman. So infancy, you have to check for this poor feeding, right? So we get hypotonia and floppy baby. Okay. Microcephaly hand flapping for Angelman syndrome. What therapy is commonly used to manage growth and muscle mass in PWS? Because obesity, hypotonia, short stature, so you have to use some growth hormone therapy. Growth hormone therapy. Here I have put the answer here. Okay, you can check the answers here. And this is the workbook I have creating MedMadness. This will be very helpful for you. Thank you so much for watching the video. So if you like this video, please like, share and subscribe and leave some comments. If you have any questions, I will answer you as soon as possible. And this is a very important question, USMLE. Okay, in step 1 or step 2 CK or step 3, very important. Okay, now I think the confusion has cleared, right? See you next video. Don't forget to like and share and subscribe. Fine. Thank you so much.